Well, hello, Jill Sonke. It's great to see you and to have you be part of Voices from the Field on the NeuroArts Resource Center.
Hi, Susan. It's great to be here. Thanks for the invitation.
A pleasure. Now, I know that you're in Austria, so you're in the middle of your afternoon. It's early morning here in Baltimore. What are you doing in Austria?
I am doing the keynote for the Arts and Health track at the Ars Electronica Festival, which is really exciting.
Whoa, whoa, that's fantastic. That's really amazing. You and I have known each other for a while now, and I was thinking this morning when we first met, and I don't remember the exact moment we met. Do you?
You know, I think I heard you speak, and then you came to Gainesville and we got together for dinner. And I feel like that's when we started to really get to know each other. And I would say that was maybe 6 years ago, Susan.
Yeah, that's what I remember too, sitting
Yeah,
outside in Gainesville
that's
and
right.
thinking, what an amazing community Gainesville is, and all the amazing things that were happening and are happening at University of Florida.
That's
So
right.
yeah, maybe 2016, 2017, something like that. Well, a lot has happened since then, and I would love to have you share a little bit about what is getting you excited these days and what you're working on.
That's a hard question because there's a lot that's got me excited these days. I think, generally speaking, in relation to the field of arts and health, I'm really excited about arts prescribing and all of the innovation and experimentation and progress that's happening in that space in the United States. I think it's a really important dimension of thinking about access to the arts in the US. For me, social prescribing isn't an end, but it's a means. It's a way to help people who aren't recognizing that participating in the arts is a health behavior like exercise, can have that suggestion come from a care provider and can hopefully kickstart a habit of arts participation as a health behavior and begin to utilize available arts and cultural resources in their communities to support health. So that I think is really exciting. I think we have to take a lot of care with how we approach that, especially from a policy perspective. I don't think arts prescribing or social prescribing, the broader context, in which that is developing, should be sort of top down policy oriented in the US, at least not right now. Although I do think policy will be really important for funding and providing funding for artists and arts organizations in every community that want to exist and want to have a thriving program that can support people's health. So that I'm excited about. I'm excited about all of the convening that's happening in this field. There's so much convening right now and great conversations that are bringing people together globally to talk about this field. I'm excited about the attention to quality of evidence, and I'm excited that there's enough evidence now that we can synthesize it. So I'll stop there because that's three answers to one question already.
Wonderful. I think a lot about the parallels around the work in arts on prescription and social prescribing and neuroarts and the way that evidence is so important, but also in thinking about the way we've talked about neuroarts becoming something that's mainstream in medicine and public health, and that policy really gets created. And so if you think about these intersecting and sometimes parallel tracks. This notion of evidence is so important, but dissemination and scaling is really ultimately, I think, when we talk about policy, that's what policy ultimately provides. And I loved what you're saying about this idea of arts on prescription or social prescribing, however we name it, can't be top down. It needs to be probably sides in and bottom up. And I'd love for you to just go a little deeper in really explaining how social prescription or arts on prescription can happen with the different kinds of healthcare providers and what that looks like. And maybe we can ultimately get to thinking about some of our aspirations about how these kinds of experiences that ultimately lead to whole health become part of the economic sort of driving model that where I think we would agree there's still a gap there.
Yeah, for sure. So arts prescribing, like nature prescribing, social prescribing, generally is about referrals or prescriptions being made by care providers. And I like to think of that term really broadly. So that is, importantly, but is not only people who are working in the healthcare or public health systems like physicians and nurses and other care providers, but it also includes other people who care in communities, right? People like teachers are really important, librarians, people who are listening and who have access to understanding the needs of community members. So I think networks around arts prescribing and social prescribing should include others beyond healthcare. And we're seeing that. We're seeing arts prescribing programs coming from partnerships with schools and all sorts of arts programs. So it's about referral. And I think it's really important to underscore that it's about network building. It's creating a network of linked resources that support health in communities. And I think one of the opportunities around arts prescribing in particular, like nature prescribing and other forms, of course, is that it can build hyper-local networks for supporting wellness and well-being. And that's another important component. Arts prescribing, social prescribing is meant to kind of fill that gap for people who don't have as much access to wellness and prevention resources. And that can include people who are uninsured, who are underinsured, people who are not accessing health systems because of barriers, transportation, economics, or lack of trust, or lack of welcome, or lack of familiarity, right? So it's about looking at how we can build really hyper-local networks that can generate health in communities right down to the neighborhood level.
I love what you're saying, and I really think that in some ways we've seen this in the United States be very successful with pediatricians. I know pediatricians have long prescribed nature. They've prescribed sitting at the table for dinner and sharing meals together, and also going outside and playing. And so we've seen that be very successful. And while payer models are really important, I also think that the arts and aesthetic experiences are affordable, and they're can be accessible, and they can be immediate. So while we're working towards this payer model, we don't have to wait. And I think you've been talking quite a bit about that. You mentioned some pilots and some things that are happening in the US. I'd love to hear about some of the programs that you think are really starting to take flight, and maybe even some of the data that you're starting to see with Arts on Prescription.
Yeah, there are some really exciting programs, and lots of them, Susan. So we just in the EpiArts Lab just finished 23 case studies of social prescribing programs, but really we were focusing mostly on arts and culture and nature prescribing. And we saw really amazing examples from the program in Newark, New Jersey, which is a partnership between the New Jersey Performing Arts Center and Horizon Blue Cross Blue Shield. That's an exciting one because it includes an insurance company as a partner, and that insurance company understanding the value of the arts and also interested in allocating its reimbursement infrastructure and resources to arts prescribing. So that's a really exciting program to watch. We saw innovative partnerships between zoos and referral partners. So not just arts, but, defining the arts very broadly. And we also just finished an implementation science study, which included a really deep dive into 9 of those programs and a really deep look at what the enablers and barriers are for those programs. So we're seeing things like lack of understanding of what social prescribing and arts prescribing are, both among care providers, the healthcare system, and among the general public, is one of the barriers right now. So I think it's important that we're socializing this idea, talking about this in order for this to advance. We also learned about barriers like transportation, which link workers and as an important enabler, right, in this system are helping to address. So we learned a lot about those studies, and we don't yet have evidence in the United States that's synthesized to the level beyond these two studies that helps us understand outcomes. So in these two studies, we were looking more at structures of arts prescribing and social prescribing and barriers and enablers, the implementation. But we don't have solid outcomes research yet in the United States, although our neighbors around the world do. So we know from the UK, we know from Canada that social prescribing and arts prescribing programs are yielding significant benefits around well-being, prevention, and also economic benefits. So they're saving money in our healthcare systems. They're demonstrating return on investments. And I know you've been involved in some of that research, Susan, which is really important.
Yeah, the economic return on investment, I think, is another kind of evidence. And we've done now three types of economic analyses. The first two were really focused on looking at Alzheimer's and music, and a very modest intervention of a music either beholder or active participation in music once a month. And what we saw was that there was a 2.5 times return on the investment. And what's interesting about that is it's a virtuous cycle, because it not only helps the person that's experiencing Alzheimer's, but also the caregiver, the family. Then we came back and we said, all right, well, what is the true value? What would it really mean if we were to look at the implications for society? And the implications for society are exponentially larger. And these are only economic kinds of values. But when you think about quality of life, and I think that term is so misunderstood. What does it mean to live a full, rich life and also be experiencing Alzheimer's? And there was a recent study that just came out from UCSF looking at not only the decline in brain cognitive abilities through Alzheimer's, but the gains and what's happening neurophysiologically in the gains. And I think we tend to think of disease as being one directional, but in fact there are these offsets that come back and forth. And how do we understand that and come back to this idea of quality of life? So economic work is really important for sure.
Yeah. And Susan, I want to just pick up on this notion of virtuous cycles that you mentioned, because this is coming up in our research. And I think it's really interesting that we're understanding these virtuous cycles a little bit more in terms of the relationship between the arts and well-being. As you know, we just finished 3 years of research around the One Nation, One Project Arts for Everybody initiative. And in this project, which included 18 very diverse cities across the United States, we did 12 studies. We did a lot of research, and we combined 6 of those studies in one mixed methods research study. And another one of our studies was, one of our foundational studies was an integrative review of the literature. And so we looked at other research that examined relationships between arts participation, social cohesion, which we were particularly interested in, meaning not just the presence of social relationships, but the quality of social relationships and the level of solidarity, that they produce, that allows communities to collaborate toward greater goods, including health and arts participation. So we looked at studies that examined arts participation, social cohesion, and well-being. And as we synthesized those studies, we developed a conceptual model that suggested a virtuous cycle related to arts participation. And that's that when people participate in the arts, especially when it involves co-creation, making things together, like preparing a performance, an exhibit, those sorts of things, and cultural sharing, either within or across cultures, that you cultivate a commitment to other participants, right? You're building social cohesion and relationships. You build a commitment to the program itself, to the work itself, and that means you participate more. We also identified that participation generates well-being through a number of mechanisms, relaxation, mental health, those sorts of things. So we've found this virtuous cycle that that when you participate, that commitment that's generated means more participation, which means greater benefits. And we know that with virtuous cycles, there's the opposite of that, right? David Bencourt, in a recent study, also identified a bidirectional relationship between arts participation and well-being, and that, the better our well-being, the more we participate in the arts, and the more we participate in the arts, the better our well-being. So these virtuous cycles, as opposed to the opposite, right, are really important to understand.
And you can see that in both community health and also relationships to clinical care and clinical health. We're seeing very similar results happening with the community NeuroArts coalitions that we've been building through the NeuroArts Blueprint. And, we started by communities coming to us saying, we would like to do more of this evidence-based work in our community. So totally organic. And as that developed, what we've been seeing is the exact kind of results where educators who have been really experiencing secondary trauma are now saying, oh, I'm using the arts for what I need, or communities are coming together in a different kind of intention. And I think we're seeing municipalities start to understand the value of that as it relates to crime, as it relates to the justice system, to educational systems, to community infrastructure, to parks. And so I think we're at a nexus where we're beginning to be able to have the evidence and see the evidence and share that, but also start to look at infrastructural changes that help to make this part of an ongoing ecosystem. And at the same time, I was very saddened by the report that I think you just brought out about the decline in reading. And these are a tension of opposites that are continuing to happen. And I'd love for you to share a little bit about that.
Yeah, one of our EpiArts studies suggests that reading has declined by 40% among people over the age of 16 in the United States over the past 20 years. We know there's been a decline in reading over the past 80 years in the United States, but this is a very significant decline. Over the past 20 years, it represents a 3% decline per year. And it's very significant because reading is among arts participation forms a significant health resource that we have available to us. So these findings for us raised a number of concerns. I mean, we did not study why, right? But we can presume why, and we can reference other things we know from other research in terms of thinking about why this is. We know that there are correlations between reductions in reading, and digital media engagement, for example. As social media is so prevalent, other forms of digital media, they're competing for our time and attention, right? We also know that people in the United States just have less leisure time these days. So we've got more competing for our attention in this time. And we also know that reading is really important for educational readiness and attainment. One of the things that surprised me most in this study was that among the over 236,000 people who participated in this research, and that was through the American Time Use Study, 21% of them had children under the age of 9 at home, and only 2% were reading for children. So that number didn't change much over the past 20 years, but I was really alarmed at how little people are reading with children at home, because it is so important to educational readiness and attainment and lifelong learning across the lifespan. We also know reading is linked to relaxation, to mental health. It stimulates the imagination and our creativity. And as a mom, I really was astonished at the lack of reading in relation to bonding and just really
Hmm.
good, special time with our kids that was so important to me as a mom.
So we have work to do.
Yeah.
And it is extraordinary when you think about the demands on time. And I think that's one of the
Yeah.
things about the arts and aesthetics that we sometimes forget. And I think it's a huge problem is that we think of the arts as a luxury. We think of them as
That's
something
right.
that you do when you have time.
Hmm.
And shifting the lens just a little bit to say that the arts and aesthetics are in everything that we do. So they're in cooking, they're in taking a
That's
walk,
right.
they're in singing in the shower, they're
Yeah.
in those moments of holding your child's hand and shifting that lens to a way of living artfully, my sister would say,
Yeah.
is something that we all can do. And it's joyful and
Yep.
it changes your neurotransmitters. And so in some ways it is not, it's not like, taking the medicine, right? That tastes so bad. The more you do it, the better you feel. And
That's
that's
right.
where maybe shifting for a couple minutes into thinking about the shift to public awareness and
Yep.
how we start to, we do always need more evidence in any field of study. The more evidence you have, the better. And I think that is really something that there has not been a lot of money from a federal level in our country put towards really studying the arts and aesthetic experiences and how it can really enhance society in all the different ways we know. But I'd love for you to talk a little bit about some of the ways that sharing this information is happening. You mentioned One Nation, One Project, Arts for Everybody, which I think had a really profound impact in showing that this is accessible. This is not something that's for people
That's
that
right.
are privileged necessarily.
Yep. Yeah, Susan, one of the things I was most excited about from our findings from One Nation, One Project is that counter to the studies of arts participation in the United States that have consistently shown that people with higher incomes participate more in the arts, right? We know that's true. We know there are social gradients that persist in the United States around who participates in the arts. And the way the arts are defined in those studies are really important too, because I think
Mm-hmm.
they've often been too narrow, more, formal and institutionally oriented. But in One Nation, One Project, we actually found that people with lower income participated more in the arts across those 18 studies during the project period. We
Mm.
know that those 18 communities worked hard to expand access to the arts in their communities. And so we think and we hope that those
Mm.
efforts made a difference and changed access to arts in those communities. It may also be that we had a wider definition of arts participation,
Mm.
including social practices, cultural practices, heritage, spiritual practices,
Mm.
things that people, creativity at home, right? Things that people may not often think of
Mm.
as the arts. But I was really excited that we were able to show that we can expand access to the arts. So across those 18 communities, and not people who participate in those programs, but among the general public,
Mm-hmm.
arts participation increased by 56.4% over the 2 year project.
Extraordinary.
So we did it. We
Yeah.
expanded access to the arts. And we also saw that in the general public of those communities, social cohesion increased by over 12%. And we saw a
Mm.
dose response relationship between arts participation and well being and social cohesion and well being. So the more people participated in the arts, or those who participated more, had higher levels of both social cohesion and well being. So we can change that paradigm.
Mm-hmm.
You're right. I mean, that we, generally speaking, consider the arts to be a luxury in this country, right? That has been a part of the paradigm, and it's a part of the paradigm that needs to shift. We do need to continue to raise awareness of what creativity is and how we engage of it outside of those formal modalities, and we need to increase access to things like performances, right, and classes, ways that people can engage, and we need policy that creates more investment in the arts so that people can just access them more readily. We see that in other countries.
Well, I love the definitions of broadening arts. I talk about the arts as creative expression. And when you even move away from creativity and think about just how do we express ourselves, it is in its nature a creative act. And there's no one that is ever going to be like you. You're so uniquely yourself in every single one of us. And so then the beautiful opportunity is, how do you bring that forward? And it could be through what you wear. It could be how you wear your hair. It could be the way your family moves at night, dancing before bedtime. All of those things are so alive. And I think it also comes back to sensory experiences and how we bring the world into our bodies, brains, spirits. It's so fascinating to me that this this concept around creative expression gets lost as we get older too, and we sort of I think by the time you're in third grade, you start to shut down your sharing your whole self because someone's told you, oh, that's not appropriate, that's not good, you're not good at it. We have an upper level neuroaesthetics course at Hopkins that's now in our second year, and we start off by asking students, has there ever been a time in your life where an art or an aesthetic experience impacted you in some way? And a lot of these students are international students, and for hours they go around and share their stories. And two come to mind that really, I think, underscore your point about what we do here. One was from a young woman from Nigeria who danced every day in Nigeria. That's just part of her culture. And when she came here, there was no dancing. And she really has felt cut off, literally cut off from her body. And we know that that kind of dis-ease creates disease. And another young man from Lebanon talked about remembering, and I think he was a young boy when this happened, but it stuck with him, where his country, in protest to the government, held hands across the country and they sang. And he remembers doing that, and this sense of sort of unity and solidarity in his community was so strong that he still holds that as being one of the most fundamental reasons that he's now studying neuroscience. And so, this next generation of youth coming into leadership roles, I think, have a different sensibility about how to live their lives, but also the importance of this work. And you mentioned New Jersey, and you've had a lot of students come through your program. And maybe as we close out, I'd just love for you to talk a bit about how you feel about the future of the field.
Being grounded in an educational program like you, Susan, we just continue to see more interest among young people. I think for more than a decade, if not two, if not three, really, I've been seeing young people seeking more meaning in their relationship to their artwork. So students of the arts in university are aiming not just for studio art practices or performing on stage or, those sorts of, top probably 1% of the arts experiences, but are looking for how their art can make a difference in the world, and they're looking for different applications. So we are seeing increases, I think, in interest among young people. And I hope that that will manifest culturally in more visible relationships between the arts and not only health, but other forms of social good that are certainly related to health, like young people engaging the arts to work in civic spaces and political spaces and environmental spaces and transportation, in all these spaces that are really critical to quality of life. So I'm hopeful in that way. I also think, you mentioned older adulthood, Susan, and, you're talking about how we disconnect from the arts early in our lives. And I think I may be biased because I'm moving into this stage of life myself. But I feel like I see more people who are, coming into their 50s and 60s and 70s, leaning more into creative expression and leaning
Mm.
more into the arts. And one of the things that, from a researcher perspective, is hopeful for me around that is that studies from around the world, including our own in the EpiArts Lab, continually show, and we found this in One Nation, One Project as well, that there's a sweet spot of health benefits at once a month
Hmm.
participation, especially among people over the age of 50. So it doesn't take a lot of arts participation
Mm.
to gain health benefits. And I think socializing and social connection, which is more and more important today as we're experiencing greater social and socio-political divides, is another way in which the arts are really, really important. And I think building an arts infrastructure is an important part of really building social cohesion, people who are connecting across difference, people who are building social networks in their communities. It's just so important for our health. So I'm hopeful in all of those ways because I see not only progress in all of those areas, but more attention and more thinking and more dialogue around those topics.
I think attention and intention is shifting. And also this intergenerational opportunity between creative aging and youth is such a great opportunity to sort of help both kind of ends of the spectrum. And maybe just, when you were talking about creative aging, I was also thinking about in this country, AARP, which is probably the largest organization that represents aging Americans. And although it keeps getting younger, now AARP, I think, is interested in early childhood because that's where the action is. If you're really going to make a difference in aging, you need and resilience and cognitive decline, you need to really start early. And we don't teach that in schools. We don't teach sensory literacy yet in schools. But maybe to end on your word, which I love, which is hope. I think the arts are hope, and they give us so much opportunity to be our whole selves and also to be whole in community. So thank you, Jill, for spending time with me this morning and this afternoon. It's really great to be with you.
Thank you, Susan. It's always great to talk with you.